All right, so this one is a glimpse into your child's ADHD brain. Basically, it's talking a little bit about some of it's going to be like a general covering of what ADHD is and some of the different things that goes with it, and we'll kind of go from there. So the reason why I'm talking about this, a lot of people get confused when a chiropractor is going to be talking about ADHD or like any of this other kind of stuff. But I'm not your, well, I guess you can say I'm not your average chiropractor. I'm a board certified functional neurologist, which means that I have like 900 some plus hours in diagnosis and treatment of different neurological disorders. I've had specific training in childhood neurobehavioral disorders. I have a bunch of other certifications and other things as well. Um, but that's basically me. So I've done a lot of stuff when it comes to this. I've treated it like a good number of patients that have had ADHD, and I have gotten pretty decent success with it. So we'll get into the meat of it and what is going on. So again, what is ADHD? Just some of this might be basic for you, but basically, again, ADHD is attention deficit hyperactivity disorder, and you can have all kinds of different definitions and other kinds of things that people can define it as. But obviously, one way that you can define it would be a chronic behavioral disorder that is characterized by behavior that's going to have hyperactivity, impulsivity, inattentiveness, or some combination of those. And we'll get into that a little bit more later on. A little bit further on what it is the thing that's interesting to know about it is that it is the leading disorder of any kind of childhood in the world. So biggest mental disorder among youth. It's the number one reason why kids end up getting medicated. It affects around 1 in 10 kids, and this is as of 2016, according to the CDC. There's other numbers according to, I think NIH has it at about half of that. So, but it depends on how you count it and everything else. But again, 9.4% of the population. I've seen other things that say something like 11.6% of the population as well. So again, there's a lot of different things that obviously that there's issues with when it comes to affecting these kids. Again, 50 to 60% of these kids continue to have ADHD symptoms through adulthood as well. So again, it affects children, adolescents, adults. It has, so obviously there's a lot of big deals when it comes down to it. The thing to remember though about ADHD is that remember that all kids are going to display symptoms of ADHD sometimes. Every kid is going to have like the inattentiveness or the not paying attention or, any of that kind of stuff. The issue is that kids that have ADHD have symptoms that are going to be more severe and they're going to be way more consistent. So it's when they start end up having difficulty in school or difficulty with family and peers that's where it ends up becoming problematic. One of the things that happens with ADHD is that over the past couple of decades, the incidence of it, the amount of people that have been diagnosed with it has been increased over 200%. A lot of that, there are some things that, like you can argue about other kinds of conditions like autism and whether or not it's due to finding it, doing a better job finding it. But I think that this is a major part of it, is doing a better job finding it and being able to get things treated. There's also, in some cases, there are some incentives, obviously, from a teacher's perspective to get better control of the classroom, that sometimes kids getting medicated is a thing that gets pushed forward where, doesn't always necessarily need to happen, in my opinion, but it just depends on the person. The other thing that happens with ADHD is that if a kid ends up having a diagnosis of ADHD, it's likely to mean that they have other labels. So other types of neurobehavioral disorders, and it can range from any of the number of them, which we will go over a little bit later on. So the general idea is that when you end up having those other labels, so something like OCD or Tourette's or other kinds of stuff like that can be an issue of what you end up having with ADHD as something that they can get later on. So some of the stuff that when it comes down to ADHD, and this is like you can call this the scary slide if you want to, but this is the types of information about the different things that it can affect kids later on. And there's a higher dropout rate in kids that have ADHD. There is a higher divorce rate in families that are affected by ADHD and autism. Those two are combined in this case. But again, 300% increased risk of substance abuse and dementia. And kids with ADHD are at a higher risk of getting injured, and they're about twice as likely to be injured and need medical attention. So it's one of those kind of things where, again, this is lifetime stuff when it comes to kids. Again, kids that have it end up becoming teenagers that have it, or adolescents that have it, and then they end up becoming adults that have it. So there's obviously multiple different issues and problems that comes along with that. So getting into ADHD, there's different types. The actual term ADHD, where it's, the attention deficit hyperactivity disorder, doesn't actually like describe every kid that has ADHD, because some people have the first D and some people don't. Some people have the H and sometimes they don't. So you could have sometimes they have the attention deficit and sometimes they have the hyperactivity. So the different types of ADHD is that basically there's three different types. There's inattentive, there's hyperactive and impulsive, and then there's the combined type. So to just kind of like go through, I'm not going to read everything for you guys here, but when you look at the different types, the inattentive type is the classic type of ADD that people talk about. And technically in the classifications, you really don't talk about ADD and ADHD. It's ADHD is the classic, it's the umbrella term for everything. And then it's divided into the different types. So the classic ADD. So again, the easy distraction, not paying attention, that kind of stuff. Not, being forgetful, those kind of things. All of that stuff is the inattentive type. Again, most of the time, that's not the one that is disruptive. Those are the kids that'll fall behind and have problems, but they don't necessarily cause issues for other students and stuff. It ends up being more them that's the issue. The other one is the hyperactive and the impulsive type. So this is the one that's like the classic, everybody's running around, the parents don't have control. They, and they can't control themselves for blurting out and answering questions, interrupting, difficulty waiting in line, and all that other kind of stuff. And then the last one is obviously the combination of the two of them. So you have combined type, and it's basically when you end up having the attention deficit, and then you end up having the hyperactivity combined together. And again, the combined ADHD type is the most common type of them. So most of the time, kids have both of them at the same time. But that's not it. Kids that have either one of or any of the three types of ADHD also have the tendency to have a number of other things. And hopefully you can see this very well. This one's a little bit smaller. But depression, anxiety, other types of conduct disorders, oppositional defiant disorders, learning disorders, substance abuse issues. There's all kinds of different stuff that comes down to it with that. So the kids can have things, and again, some of it's just like the repercussions of having ADHD and falling behind and other kinds of stuff, or the social stuff that's there, with the depression and the anxiety. And then some of it is basically intertwined with it. So you can have multiple different aspects there. So that's that. Now, the idea is that when it comes to the diagnosis of ADHD, the issue with it is that when it comes down to it, there's no standardized test to diagnose ADHD. It's done by a trained mental health professional, and family and teachers are obviously involved, but basically it's the opinion of the mental health profession, and the family and the teachers aren't really the ones that are going to diagnose it, but the trained mental health professional is going to be the one that does it. It's kind of the same thing with autism. There's no standardized test of, yes, you have autism. There are certain guidelines that they have from the American Academy of Pediatrics. So for example, if a kid is having issues in school or academic development, or in thetheir relationships with their peers and their family, then that's when they start saying that you should look into getting that diagnosis or looking after it. When that happens, obviously you need to gather information. You need to find out about the assessment of symptoms and figure out how things are at home compared to how they are at school. You want to try to figure out the age at which the symptoms started, and then how much that behavior kind of affects the kid's ability to function, to learn, to socialize, those kind of things. Again, symptoms need to be present in basically one of or in two of the child's like different settings. So, if you talk about like school and home, or school and then maybe daycare and that kind of stuff. So they need to be present in more than one. So it can't just be at home or just be at school. So if they're completely fine at school and they listen at school, but they don't at home, then again, it doesn't necessarily count. And then that typically needs to be going on for at least 6 months. So, and then obviously you can figure out like whether or not there's any issues with like medications and other kinds of stuff as well. But so that's all the information about what it is and like what the definitions and everything like that we have. But when it comes down to it, the thing that everybody wants to know is like what's actually happening with ADHD. And the real answer is that there's no good answer, right? There's no simple answer that you can just like, here's like the excellent quote that you can give to a news source or something like that. But there's a bunch of different disorders that are intertwined with ADHD, and they're all interrelated. So dyslexia, OCD, and when we talk about the different, the smorgasbord of things that people will have, again, kids typically have 3 diagnoses. These are some of the ones that they end up having, right? So dyslexia, OCD, Tourette's, learning disabilities. Again, the thing that was on the other page about the oppositional defiant disorder, the pervasive developmental disorders, Asperger's, autism, all of those kind of things are issues that are typically, again, it's not all of them, and it depends on the kid and where exactly in the brain that they're having issues. But the issue is that in general, those types of disorders are affecting the same general types of areas in the brain. It just depends on where and how much that it's affected in different degrees. So again, all of them have an impact on the cerebellum. All of them have an impact on the thalamus, the basal ganglia, and I should say, and the prefrontal cortex. So the prefrontal cortex is like the area that's like above your eyes and basically above your temples and stuff like that, in the brain itself. So there's a multiple different locations that are affected by this. Now, when it comes down to it, basically the treatments that you end up having for ADHD is that there usually ends up being, the main one that people know is basically the main one that people know is going to end up being medications. So medications, and the medications basically Ritalin and Adderall. Both of those are basically stimulants that are used, and you can also use antidepressant medication is kind of used off label to treat kids as well. But the thing to remember is that basically most of those, because they're stimulants, end up being like basically methamphetamine. They end up being speed for kids. And the other thing that's interesting about all of it is that the mechanism of how it actually works isn't actually known. So when you start talking about kids that end up having some of these issues, sometimes a kid will be put on a medication, and because there's no specific way to diagnose whether or not the kid has ADHD or whether or not they have one of the other conditions. They might have things that are overlapping, but they could get on Ritalin or Adderall and it could make it worse or it could make it better, but nobody knows exactly why it actually makes it better. The other thing that's interesting about it is that the main reason why kids end up getting put on these is that they, parents obviously, they want their kids to do better in school. Obviously, they don't want to, have distractions and stuff like that, but they want their kids to do better in school. And the thing that's interesting about all of it is that when it comes down to it, it actually might make them perform worse, especially in boys. So there was basically a study that was done in Quebec that had like 4,000 kids in it. And over an 11-year period, they found that there was no significant benefit to school performance for kids who took the ADHD drugs compared to the kids that had ADHD that didn't take medication. Now, granted, that could be because the ones that took the ADHD medication might have been worse and that might have brought them up to normal, but there is no difference like according to that. So it said that the boys that took ADHD drugs actually performed a little bit worse in school than those that with similar number of symptoms that didn't. And the thing that was also interesting is that the girls that were taking the medicine actually were reported to have more emotional problems. So those are interesting little side effects that are there. And obviously, if the kids aren't, if it's not improving their school performance, then obviously there might be other ways that you can um, do some things in order to help the child. Now, other things that are there are going to be behavioral therapy, counseling, education services. There's training for the kids, there's training for the adults too. Because in some cases, again, not every case, but in some cases, there's parental issues as well as what the kids are getting away with. And basically, the thing that I would tell somebody is that I'm never going to say that it is a parent's fault that a kid has ADHD issues, but I can tell you that you definitely need to have good parenting in order to help the kid recover and get out of it, and do as well as what they can. So there's multiple different issues and different ways to actually approach it. And again, from the standpoint of what we talked about before with the 80% divorce and all that other kind of stuff, that's obviously things that you want to try to avoid by making sure that, that the parents are getting assistance where they need to get assistance. So when it comes down to it, we end up having this whole thing about human brain development. So this is kind of like where it ends up, becoming an issue, is that there's certain things that happen in humans that set us apart from other animals on the planet, right? So you can go into all kinds of different stuff, and like if I was in class, I'd make you ask, questions to each other, and we'd answer it and all that other kind of stuff. But when it comes down to it, there's certain things that we have that make us a little bit different. So obviously, one of them is intelligence, language, being able to talk, um, consciousness, self-awareness. And again, some animals might have some of that. Again, you can argue, and like there are entire like courses and sure that you can take on which animals are conscious and which aren't. But many of them aren't self-aware. You can't necessarily like take many animals and show them a mirror and have them realize that it's you. So, but what is the reason why we end up having some of these things? Why is it that we're so much more intelligent than many other animals, right? When it comes down to it, the question is why. And I'd ask, is it the fact that we have better genes or different genes, or is that we have like a largest body mass, like the largest brain mass per body size? And I'd ask you those kind of questions. And you think about like dinosaurs and having small brains and all that other kind of stuff. But really, when it comes down to it, is that our genes aren't majorly different than other animals. Like the amount that we share with certain, other species, again, ends up being really, really high. When you talk about the largest brain mass per body size, we're actually not the highest. And especially when you talk about like the amount of the size of our brains compared to other animals, and then the amount of our intelligence compared to other animals, there's got to be another reason. And basically what it comes down to is that the main kind of thing that kind of pops it out is that there ends up being issues in our brains where we end up having better timing and better coordination of the different regions of the brain than other animals do. So when you start talking about it, it's that using multiple different areas at a time in the brain in order to accomplish the things that we need to accomplish. So, interesting things about human brain development is that a kid, when they're born, they have about 25% of their brain mass when they're born. But by the time that they end up being 3 years old, they have their brain grows to about 90% of the final adult size that it's going to be. Right. Again, little kids, they've got big skulls and they don't have a lot of other stuff that goes, like their face isn't as big. But when you grow up and as you grow bigger, your face kind of grows into your brain, basically, is the way to look at it. So you start talking about that, and the genes that we have that are in, that we do have end up getting turned on to increase the size of the brain. Obviously, this ends up being, there's multiple different things that you can talk about with this, because we have the ability to walk, and the size of our brains that you end up needing, we can't be born with too large of a brain, otherwise, or too large of a head, otherwise you can't actually give birth. Because if your head is too big, then you can't actually fit out of the birth canal. So you need to be able to do that. And then there's obviously arguments that you can have about like, the ability to walk and whether or not that is something to do with our brain development as well, but that's one of the things that's there. But when the genes end up getting turned on in the brain, it's not necessarily related to the number of neurons that you end up having in the system, but the supporting cells, things that we call glial cells. So there's a handful of other things that are associated with it. So interesting things that's there. One of the things that we have in the brain is this system, or this thing that happens called neuroplasticity. And neuroplasticity is basically the idea that the brain is changeable. It's not plastic as in like, something that is, like the hydrocarbon thing that's made from oil. You're talking about neuroplasticity is the ability of the system to actually change and adapt itself. So um, it basically, it's going to cause the growth of the brain. So neuroplasticity, it causes the growth of the brain with each cell becoming larger and a little bit more insulated than what it would be, right? So the idea is what it comes down to it is that we have this issue with neuroplasticity, and the neurons have the tendency to grow, and then they become better connected as they grow, right? So as you can see here in the picture here, when you start off on this one off on the left side, again, you've got some little, again, this is kind of looking at what a cell would almost look like. You end up having these dendrites that are coming off on the sides, or the axons that are coming off, and they can go and they can do different things. But as the system gets healthier, the cells get healthier, they're able to make more protein, they can actually, more activity. The stronger that they get, the more that they can build, and they can actually build more and more connections. So you can get more intricate connections as things go on. So the idea is that the neurons, they're going to get larger. They're going to end up becoming more insulated by what we call these glial cells. And the glial cells are these supporting cells that you end up having in the brain. And in general, because they become larger and because they become more insulated, the speed of the impulse or the speed of the transmission ends up going faster and faster and faster. As you start doing that, you end up getting more networks that are together, that are nearby each other, can start getting activated simultaneously. So when one area gets activated, another area can get activated. And what happens is that they start to coordinate and integrate the different areas of those cortical networks. So when you start increasing that coordination, again, like as it happens, it initially is going to occur like right around itself. So it's going to be shorter, like kind of like connections. So things that are kind of close to each other. But when things start to, continue to improve and they continue to do better, the integration will happen at longer distances. So again, it can happen like cells that are right next to each other, but you can also have cells that are firing into other areas that will actually grow. And they will, as the cells fire into other areas, those connections end up becoming stronger as well. So structures that end up allowing crosstalk in between the two sides of the brain and between the right and the left brain, those are going to start to increase in size. And this is the general kind of normal process that you end up having when the brain matures. Like as it gets better, as a person gets older and as the brain matures, there's specific patterns that typically happen. And again, these are the kind of things that happen. This ends up being part of the issue, is that in most neurobehavioral disorders, there is some kind of issue where the normal process of maturity doesn't occur the way that it should. And when that happens, it's basically something that is called a functional disconnection, right? This functional disconnection is one of the names that they have for it in the literature. It's one of the names that they have for this kind of phenomena inside of the literature. Basically, it's also known as developmental disconnection. You can call it decentralization and underconnectivity, and central coherent. That's not the right one. Sorry. So central coherence is not the right one. But basically, what it comes down to is that the general idea is that there ends up being a poor coordination of the different brain regions that leads to an inability of these larger networks to coordinate processes in time and space. So it's one of those things where they don't connect very well, and because they don't connect very well, there ends up being issues. So there's an inability of the brain to integrate and bind information from the multiple areas of the brain simultaneously, right? So that would be an idea of, like what happens when you're distracted in general. If you have 1,000 different things going on, you have a hard time doing it. So an example of this one would be you're lost and you're looking for the place that you need to turn, in the street that you need to turn on, and you're looking for the street name, and you don't have your GPS that's sitting there telling you when to turn. So because of that, you want to make sure that you concentrate. So as you're slowing down because you don't want to go past it, you reach up and you turn down your music because you don't want to worry about trying to integrate and ignore the music and ignore the sound at the same time. So your brain, like, you can shut that down because you know that that's one of those kind of things where, like, hey, I can pay attention better if I turn this down a little bit because I really want to concentrate on this one thing. Right, that's kind of an example of a way that we kind of normally will do things in order to change it. So again, these certain types of networks will basically go through and you start to process information. Um, in certain areas of the brain, will start to process things faster than other types of networks. So if you have two different networks that are trying to process and integrate related information, if one pathway is working well, and then another one isn't working very well, then the one that's working better is going to start to get physically larger and it can start to mature faster than the other one. And then if that's the case, when you end up having one that is working really, really fast and you have another one that is working maybe slow, then the one that's working a little bit slower or not quite as fast as the other one starts to basically be ignored, and you start not actually integrating the information the way that you should. So there's multiple different pathways and there's multiple different types of pathways that show here. Again, this is just a cross section of the brain. This is not expecting you guys to know exactly all of this stuff. But basically, when it comes down to it, again, you have different connections that are in through here that are down here in the cerebellum. Those will come up. They'll come up to the prefrontal cortex. They'll come to the motor areas. There's different areas in the thalamus, which is deep in through here. So everything is interconnected and they're wired around, where one thing kind of comes to another one and goes from there. So there's a lot of different stuff that's these connections. Again, the frontal lobe, the striatal lobe, which is going to be part of like movement, in the basal ganglia and stuff like that. And then you end up having the cerebellum. All of those end up being interrelated. So the thing that's, other things to kind of notice is that when it comes to pathways in general in the ADHD brain, the pathways end up being typically, and again, this isn't 100% of the time, but when it comes down to it, people that end up having issues with ADHD typically have more issues on the right side of the brain. So in cases where people end up having a stroke in the right side of the brain, this is where things get damaged, where things aren't, like, either they get killed off and they're broken, whatever. With people that end up having a stroke, people that end up having these kind of things, increased impulsivity, so doing things that they, like, without waiting for it or going from there. Their reduced ability to adapt to errors, an inability to control your emotional responses, a decreased motor inhibition where you just do things without even thinking about it, not having great social skills, having problems with attention, right? Having a decreased idea of like your spatial awareness. So those are all things that are characteristic of things that are right brain types of issues. And again, this is what it comes down to. And these are things that, again, this is not just ADHD. There are other ones that, because again, they're all interrelated, but sometimes the social skills aren't there because either they're not paying attention to it, they don't know it, they have all that other kind of stuff. But not everybody, but a lot of the kids that have ADHD and other kinds of stuff, they get hurt because they just don't have an idea of where their body is in relationship to everything else. So there's, again, multiple different parts that are kind of going on with that. So without having you guys read all of this, this is just like a bunch of different stuff that's in through here. So I'll kind of like point it out here, right? So the things like ADHD are associated with alterations to the prefrontal cortex and its connections to the striatum and the cerebellum. So this is stuff from specific types of research. I'm not going to give you the stuff for you to look up on your own, but like there are stuff that's there. Again, the prefrontal cortex in the right hemisphere is especially important to behavioral inhibition. So the idea is that when it comes down to it, is that there's areas that are going to be inhibitory and there's areas that are going to be stimulatory. You know, the kind of thing of the way that I kind of like will talk to people about this is that if you can imagine, you know, it doesn't happen as much anymore with Netflix and other kinds of stuff because people don't usually have like full-on TVs that they can just flip channels. But for those of you that do remember that, there are some people that are channel flippers and there are some people that are just content to just watch what they're watching. People that are channel flippers are kind of like the ADHD where their attention like shifts and they need to hit the button. Some people will just sit there and they will just let it sit on the same thing, and the channel flippers go nuts when those people do it, just because they're like there's other things to look at, even though they're not, you know, necessarily seeing anything, they're just flipping channels back and forth, right? That's one of the ways that, you know, things used to be. But that's the idea of like having that, you know, that it's not even like a delayed satisfaction, but just having the ability to just focus on one thing ends up being decreased in people that end up having right brain or right-sided kind of problems, right? And so other kinds of things that you have here. So, and there's a bunch of other stuff that I could get into. I didn't want to bore you guys with things like this. But again, atypical right hemisphere morphology. So the differences in social comprehension in kids that have ADHD were pronounced in children that have atypical right hemisphere morphology. Again, the idea of the diagnosis of it might be associated with the underlying risk of the area of social comprehension, especially for those kids that have that. So what it comes down to is that there's a lot of information, a lot of stuff that I threw at you before. And with the, you know, with the stuff about medication and stuff that I talked about, I'm not saying that no kid should ever be on ADHD medication. I'm definitely not saying anything bad about the behavioral therapy and other kinds of stuff like that, because I definitely think that those are beneficial for kids and for family members and stuff. But the issue is that that kind of stuff doesn't fix it. And while I can't guarantee that anybody is going to get better, there's ways that you can actually change the brain, right? So the ways that you fix it are basically going through and doing the different things in order to change the brain. Brain change can be bad and it can be good, right? So you can end up having somebody that has brain changes and problems and other kinds of stuff that have pain syndromes that can get worse. So somebody that has something like fibromyalgia is like pain syndromes and problems like winding up and becoming problematic. There's also another thing called reflex sympathetic dystrophy is the old name for it. But with something like that, basically it's the brain is winding up pain and it ends up being something where it's a problem with the person being able to process pain, right? That is a bad neuroplasticity. The good neuroplasticity is working on different kinds of things in order to improve the ability of the body to do whatever function that you want. So the idea is that you're rewriting the system, the brain is getting under construction, you build new pathways, you take things that are there and you use them in order to reinforce it. So again, same kind of thing of what we talked about before. The idea of having one thing that you start working and building connections, and those connections can build more connections, right? So that's the general idea of what happens with neuroplasticity and how you start doing that. So there's various therapies that you can use to activate this frontostriatal cerebellar pathway, and they've been effective at basically improving the symptoms in ADHD. So you exercise the brain, and you can exercise them using a handful of different types of techniques. So one of them would end up being something, you know, in some cases you can use taste, you can use smell, you can use sight. Again, notice that these are all sensory types of things. But these sensory things, some of them are going to be movements of the body. You're going to end up having hearing. Vestibular information is all things that are going to be part of it. So things that stimulate the cerebellum are going to be a big thing. So you can repair things and you can actually improve the function of the brain, and you can kind of make things work a little bit better. So things that improve proprioception. Proprioception is knowing where your body is in space. right? So the idea of knowing where your hand is, being able to close your eyes and put your hands straight out in front of you and have them stay there. Kids that end up having issues with their cerebellum sometimes, or anybody that has an issue with their cerebellum, if you have the person take their hands and put them straight out in front of you, you can basically end up having a situation where the hand starts to drift and it'll go off, like their right hand might start drifting down into the right, and their brain still thinks that it was where it was. And when they open up their eyes, it's off to the side. And it's like, wait a second. And it's not because they're tired, it's just because they don't know where their hand is. Or if you put their hand straight out in front of them and you have them take their finger and touch their finger to their nose, they might miss their nose. They might punch themselves fully in the face, right? Usually they don't, but usually they hesitate and they start like bringing their hand back like you're going to touch it. So if you're, if you're listening, then basically just put your hand straight out. Don't like hit anything in front of you, but put your hand straight out in front of you with your fingers extended. You close your eyes, and then I want you to just take your finger and just touch the very tip of your finger to the very tip of your nose. And did you actually hit it, or did you miss to the side? Did you touch yourself on the cheek? Or when you were going to touch it, did you kind of like hesitate a little bit? The hesitation is you not knowing where it is that your body is, and then not really trying to like hit yourself in the face, basically, right? Because you don't know where things are. So that's proprioception. Again, things that are going to challenge the balance systems. Again, balance systems again is wired into it, and again, it's knowing where your body is in space. Again, that spatial awareness, that lack of spatial awareness is things that can happen. So, and again, something like this is a kid that's balancing. You can have kids balance on one leg sometimes, and other kinds of stuff like that. You can have them balance on a balance beam, right? So there's things that you can do in order to improve their coordination, improve their proprioception, knowing where their body is in space, um, with the eyes closed and without the eyes closed. So there's a handful of different things that happen with this hemisphericity and brain lateralization. Basically, what it comes down to is that, and don't read into it too much, because there's a lot of things that are here, and sometimes people will hear these things about the hemisphericity. It's talked a lot about in like education and stuff like that, about some people more right brain learners and some people more left brain learners, and some people will poo-poo it and say that it's not something that really exists, but it is something that exists. There is lateralization, but it's never done in a vacuum. So you're never just doing right-brained activities that don't involve the left side. You're always using both. It's just that things might be more pushed on one side than the other. So people can have issues where their right brain isn't working as well in some functions and their left brain isn't working as well in other functions. So if you see this one, this is giving you an idea of like just general right brain functions of what the right brain does. So many of the things that are in here end up being things that end up being issues in kids that have ADHD. So again, the big picture type of thinking, recognizing facial emotions. That's obviously going to be bigger in kids that end up having like autism and Asperger's and stuff like that. Recognizing the emotional tone. Again, attention impulse control, recognizing humor. So there's very specific things that are going on in through there. And then the other one is obviously the left brain types of functions. So again, there's multiple different types of things that are there in these, but again, it's the interesting thing that's there. So again, if the functions of the right brain aren't necessarily what's going on, if they're not necessarily good, right? If you have a hard time recognizing emotional tone, then things that are over here may be a little bit enhanced in some cases, right? So if the left brain is doing a good job and it's like firing off all the time and doing really well, the kid might be more detailed oriented and they might do like not so great idea or not so great job at figuring out the big picture, right? Kids might be more likely to like routine or sameness, right? Whereas they might have some other issues over here, right? So there's multiple different kind of things that goes on. Again, this next one here, this one's talking about, like it does talk about the autism spectrum disorder, but basically it's the same kind of thing where you're talking about the desynchronization and the effectiveness of the interhemispheric communication. Again, by improving the way that the brain talks back and forth to each other and how well one side is working is one of the ways that you can end up getting improvements in behavior. Other kinds of things that can happen is, let's see here. So, again, for kids that have issues with functional disconnection syndrome, you can also have issues where the, again, the best approaches are going to be things that are going to be a combination of different somatosensory. So again, somato means body and sensory is the sensory types of stuff. So that's the proprioception types of things. Cognitive type of work, behavioral work. Again, biochemical interventions are going to be another thing. So again, a kid that is, eating all kinds of foods that are not good for them is going to have a harder time. It's not necessarily that you give the kid sugar and they have ADHD, but if they have a bunch of different sensitivities to a bunch of other foods, then that can make things worse. And by improving that and improving inflammation and increasing the how well the right hemisphere works, again, you can end up making things work a little bit more. You can make things balance things out a little bit and make it so that the brain actually does a better job, and then you end up having less of the symptoms. So again, increasing the baseline oscillation speed. Basically what the oscillation speed is that the brain is not like, to simplify it, the brain isn't like on all the time. It's like if a person is playing guitar, the person that's playing guitar isn't squeezing the fret as hard as they can the entire time. The person will contract when they strum, and then they might relax it a little bit in between some of those. So it's a way that the brain kind of like shuts off. There's a certain oscillation speed that the brain ends up having, which can change a little bit with a person who might not be working as well, or one side of the brain might not be firing as well as the other side. So if the two of them aren't able to work together, then you can end up having problems. So if you can increase the baseline oscillation speed, basically the way that you can think of that is increase the tone of one side of the brain, make it so that that side of the brain works a little bit better. Then you can end up having better balance between the hemispheres and then improve the symptoms. So basically what it comes down to is that there's multiple different things that you can do. Obviously, like when I say the stuff that's going to be things in through here, what it comes down to is that the things that you can do are going to be things that really should be, I wouldn't recommend just taking a kid that has ADHD and just start throwing this stuff at them, because you can overwhelm a kid with it. It might not necessarily be the right thing. They might have been diagnosed incorrectly. So somebody might say that they have ADHD and it's not really what they have. And if you start going gangbusters on a kid that ends up having some of these things, then you can end up making things worse. So I will just say like that is kind of like a, don't just use this as this is something that you should do for all kids. But in general, like if you go through and if you start pushing things like this, again, the idea is that you can do things that will activate the right brain. So again, using familiar faces, a kid that, having them identify faces of people that they know, whether or not they can be celebrities depending on how old the kid is as well. Identifying the whole and not the parts. So an example of what you could do is if, like some of those letters that, like a letter that will make up a big letter. So if you have a bunch of B's that you arrange them in a way that make up an A, you have them identify the larger A and not the individual B's, right? Things that are kind of more on the left side of the field of view will have the tendency to stimulate the right brain a little bit more. Things that are from the left side of the body, with the exception of smell. Smell from the right nostril. And again, that would be something that usually you can't like plug up the nose and make it so that you're only stimulating the left side. But you smell is something that's a really good thing to stimulate the entire brain. Thinking of other people as opposed to the self. And again, you can see how that would be hard for somebody, again, ADHD, it's hard for enough adults as it is, but thinking of others as opposed to their self. Thinking of, just being there or being in another place as opposed to here right in front of you. So again, that's more of an abstract kind of a thought when it comes down to it. So the right brain also ends up getting activated more by gross motor types of stuff. Again, postural types of things, stability exercises, So standing and holding your balance, doing it with your eyes closed, doing full body types of movements, like doing a coordinated type of a movement, and getting into a position. Again, that can be, again, this is not going to be something that's specific, but that could be something like dance, or it could be something like in karate, doing a kata or a form in kung fu or something like that. um, Interoception, that's the awareness of your body. So again, some kids that end up having issues with their right brain, they're not able to tell when they're hungry or when they have to go to the bathroom or other kinds of stuff like that. So having them work on things and do things that can maybe make them more aware of their breathing, right? You don't necessarily have to take a 6-year-old and make them meditate, but if you try to get them to breathe and take deep breaths and pay attention to that, that can be something that can be helpful. um, so obviously I wouldn't want to use negative emotions on a regular basis, but that is something that gets, negative emotions can pop up more when the right brain is working better. But that's something you need to make sure that you're considering behavioral strategies. So that's the kind of stuff that would be more from a psychologist or something like that. Um, let's see here. So at home type of activities that somebody could do, you could do things that would be left preferencing. So things that you could maybe do would be like put things that are on the left side of space, right? So put things, whether or not it's the chair, or whether or not it's a game of catch and throwing it to the left side, even if they have to reach across with their right hand, if they were right-handed to catch. But throwing things more to the left side, because your brain is going to be stimulated by things on the left side. You're also the left side, when you're using your left hand, your left side again is going to be partially controlled by the right side of the brain. Right, the voluntary movement is the left side of the brain. I'm sorry, the right side of the brain is going to be controlling voluntary movement on the left side of the body. But you can also do things like spinning in a chair. I'm not going to tell you which way to go with that, because that can be something that really can mess somebody up. So I wouldn't just spin them in a chair for the heck of it. But kids spinning, and getting dizzy and stuff like that isn't necessarily a bad thing, but you definitely don't want them to get symptoms and other problems and stuff, and like actual like vertigo or dizziness from it. So you gotta be careful. Hand clapping games. So like not necessarily patty cake, but the games that kids would play on the playground and stuff like that. Left face tapping, so touching the left side of the face, brushing it, compressing joints, distracting joints. Again, adjusting. Like I'll take ADHD kids and I will adjust them. Um, obviously they got to be okay with it, and parents got to be okay with it and stuff like that. But those are definitely some things that can be beneficial for kids that end up having some of these issues. Further activities that you could do is that, again, this is like global things where you're using like the individual like details of something in order to help figure out what you're using the individual details that you end up having in order to help figure out what's going on, or what the object is. So you're basically having the person use their left hand, and you put 10 different things into like a cloth bag. You have them reach in and then identify what it is, right? So you could reach in and have them pick up, and they would like pick up I don't know, you could make it something that obviously they're not going to break that you'd have to worry about, but it could be a paper clip or a rubber band or a pen. Obviously something that's not sharp that they're going to get hurt on or anything like that, but something that you go through and you're like, okay, they pick it up and then say, okay, well, what is this? They have to feel it without seeing it. And that's going to be something that's working their brain. You're working your left brain, or you're working your right brain when you do something like that. Or you could even go in there and be like, hey, find me the rubber band, or find me the binder clip, or the crayon, or whatever, right? So there's a handful. The other one, it would be the blind find that's here. So you can take an object and you put it across the room to the child's left, and you put it across the room, you have them look at where it is, right? So that they know where it is. Then you have them close their eyes, or like it says, blindfold the cheaters. So if they're cheating, you blindfold them, and then you have them walk across the room, pick up the item, and come back, right? Again, not, running, but having them do different stuff. Again, some of the things with like the inactivity and the hyperactive disorder is that if the kid is constantly on the go and they're never practicing holding it or practicing concentrating or delaying stuff, then they're always going to be basically firing everything off, and they're going to want that immediate satisfaction and everything else. So practicing the control is actually part of building that pathway and improving it. So, you can, doing stuff like, other things that aren't listed there. You can do what we call like go, no go exercises, where you can, like the classic example of a go, no go exercise is Simon Says, right? Where you do it multiple times, where, you say Simon says this, and then you do multiple different things, and then you get them to like not do the movement, or get them to, flash a light over to one side of their vision and make it so that say like, okay, I don't want you to look at that. Some kids, again, that's a what we call a tactile response. So when you end up seeing something that's in your peripheral vision, whether or not it's movement or a light, your immediate reaction is to try to look at that type of thing. And if you are trying to, if you try to inhibit that reflex and say, no, I'm going to look straight ahead, and try to do flashing, or you try to like snap next to somebody, a kid that has an issue with ADHD is going to have a hard time not looking at the thing that you told them not to look at, because there's a drive for the person to actually do it. So there's a handful of different things that was there. Um, so thanks for your time. I do appreciate it. That was the end of the lecture on ADHD today. Um, like like we said, like always here to help. This is something that I do evaluations on and I help people with. So obviously, if anybody is interested, you can give me a call or make an appointment or any of that other kind of stuff. And as I had talked before, there was, this is something that will be on YouTube probably at a later point, and you are more than welcome. You don't have to say anything, but just, know that, if you say anything now, then it might show up. But if you guys have any questions and you want to unmute yourselves, you guys are more than welcome to go ahead and do that and ask me questions related to this or other stuff, and I'll answer it if I can. And if not, I'll get back to you later on. So any questions from our participants?
I was just going to say thank you so much. That was a lot of really interesting information. And for me, I had never heard ADHD put into the context of a right brain issue. So that was fascinating, and it shed some light and some additional insights that I hadn't heard of or even thought about. I have a question for you though. So a few questions, but my first question is, I indicated before the lecture started that I have two sons, and both of them have been diagnosed with ADHD. My husband has ADHD, so I know that there's a genetic component to ADHD. One of the therapies that we have done that did show some promise was acupuncture. And so I was kind of
Mhm.
curious to know your viewpoint on utilizing acupuncture as one of the components to managing ADHD. And then my second question has to do with inversion tables and your professional thought about inversion tables in relation to ADHD as well.
So the thing that I would tell you about acupuncture is that I don't know, because I don't do it, right? So that's basically like my non-answer to that one. I don't know the mechanism by which it would happen. It could be you're stimulating the brain. Again, it also depends on if somebody, because there are versions of acupuncture where they do electroacupuncture, where they attach like electrodes to it and they stimulate. And again, that's going to be something that is getting in, and it could be stimulating the body in a different way. So, just like massage is something that can stimulate the body, or, again, I'm not going to say that people need to go out and buy a bunch of essential oils or something like that. But again, scent is going to be something that's going to stimulate the brain in a way. So, but if you're talking about like knowing where your body is in space and stimulating, muscles, tendons, skin, different types of stuff like that. I think that acupuncture might have a mechanism through that way, but I couldn't specifically say that. But the other one, inversion tables and stuff like that, again, that's stimulating the spine. That's going to be a vestibular input. So you're literally taking a person and like the inner ear, when you flip them upside down, you can stimulate stuff and you can do things that way. You're going to be stretching on the spine. Again, the spine is going to be a major input into the brain. Um, like the thing that's interesting is that when it comes down to it, and this is the thing that's kind of like a crazy kind of thing to think of, right? Everybody has seen and heard of like the sensory deprivation tanks and stuff like that, where you can go and float in salt water, and if you want to, you can make everything completely quiet and you close the lid and you're floating in salt water that's like body temperature. So you're getting absolutely no input from sensory stuff because you're not getting everything. The only thing that you're actually getting input from is your body itself and the contractions that you end up having in the muscles in the generalized muscle tone, because you're always getting rid of it. You can never get rid of the muscle tone that you have if you are, like healthy, and if you're, you know, like somebody who was up in space for a long time and completely had horrible muscle tone, then obviously that's going to be a different kind of a situation. But muscle tone is always going to be part of it. So somebody flipping over, muscles are going to stretch out. That's going to be something that's there. Now, the thing that's interesting is that, again, for some of these things, it can be, when it comes down to it, sometimes they can be too much for some kids, or they can be not enough, right? So it's about trying to figure out the therapy that's going to have the biggest effect in order to make the biggest impact on what's going on, right? So like, for example, it could be, in some kids, what I'll do is that, the flipping backwards and like hanging for a little while, what some kid might need is that they might actually need to go, not saying that they need to go to gymnastics specifically, but maybe they need to go out into a field and do a couple of somersaults, or roll over their right shoulder and, come up, or do a backwards roll, or get on the hill and roll continuously down, like on their, like in a specific direction, in order to stimulate the brain in that way. That's all vestibular information, where it's stimulating the inner ear, but it's also getting them to move and do other kinds of stuff. So that could be one of the things that's associated with it, or maybe that's way too much for a person, just like, like if you have a kid that is too tired, right? Anybody, right? Or a husband that's too tired, and it doesn't matter, and they don't want to, listen, right? If you get too tired, then you end up having worse issues with the impulsivity, or worse issues with the behavioral problems and other kinds of stuff like that. It's the same kind of thing of somebody getting overwhelmed, whether or not it's because they're too tired from having a long day, or having to deal with whatever it is that they needed to deal with during the day. Or it could be that you could overstimulate the person with an exercise and actually make it worse. So that's where the issue comes in, is that it's about making sure that you're going after the right thing, and then it's also trying to, modulate or change the dose so that it's right for the person. Hopefully that makes sense. Hopefully that answered your question too.
No, that made perfect sense, and it does answer my question. And I think that you're absolutely correct as far as, there's no one size fits all. There's a sort of like interesting spectrum when it comes to ADHD, even with the types of comorbidity that you might have, or even with the kind of symptomology that one might demonstrate. So that
Right.
made perfect sense. And I do think it is important to find the right assessment, the right mix, and the right tool when it
Right.
comes to assisting. So yeah, that made sense. Thank you.
Perfect. So like, it was something that's interesting on that, is that I had somebody that I know that had their kid go somewhere, and again, I'm not saying that this is not the right thing to do, or that a person shouldn't do it, but they went to I think it was an OD, so like an optometrist, and basically they were doing some vision therapy with him, which can be great. But they were doing vision therapy where they were doing multiple different colors that was projected on a wall, and it would do all these things, and it would have all kinds of different movement, and I don't remember all of the different stuff, and I never actually saw it. But the thing that they always told me is that every time that they got done with their son, is that their son's behavior afterwards was awful. It was horrible afterwards. And to me, the way that I look at that is that if you're getting all of that input and you're really, really pushing the kid in that perspective, to me, that means that they were getting pushed too far. You shouldn't get it so that the kid is being pushed beyond their limits, or that they're that's because that's basically pushing things to failure, and you don't want to do it. And the brain is really, really sensitive. You don't want to push the brain until failure. It isn't like it, the neurons aren't as strong as a muscle. When you push the brain too far, you can actually do damage. So I'll have people that'll come in that might have vertigo or something like that, and I'll tell them, I want you to do this and this. And then they think that if I told them to do it 5 times, that if they do it 28 times, that it's going to be better. And that actually can make them worse. So you have to, be a little bit careful about that. The one story that, I love talking about is that I had these two twins that were coming in. And when they were in kindergarten, they were being sent, one or the other one was basically, and usually it was both, was being sent to the principal's office every day because of all of the chaos that they were creating in the room. The parents were divorced. The mom did an absolutely fantastic job with the stuff that we had going on. And she brought them in towards the end of the year and basically worked with them all summer long. And then they started first grade, and everybody, they figured that it was going to be the exact same thing. But the kids made leaps and bounds, and they changed all kinds of different stuff. And they went from not being able to sit and do homework to both of them being able to sit and do homework and enjoy reading and doing all the different stuff that they needed to the point where one of them had oppositional defiance disorder, and that one, maybe I think it was a month and a half into school, finally had an incident. But he went, you know, a month and a half into school, had no incidents. His brother had no incidents. And they ended up doing like one of those school spirit type of awards of, making sure that, community, doing all the good things that you're supposed to, like for the school code and stuff like that. And the one brother won it, one of the, like maybe the second month in, and then a month or two later, the other brother won it. And it's kind of crazy that you end up getting a change in those kids that was, you know, so drastic, where you're talking about like, teachers being hit and, other students being hit and, running around and having all of this other kind of stuff. And they worked really hard and they ended up enjoying the kind of stuff that they did. And, I haven't seen them in a little while because then, coronavirus hit and it's been a little bit, but it's one of those kind of things where like, that it's a good thing when you can make a change like that. So it's one of those where I've had multiple different occasions to make those changes, and um, teachers are always kind of flabbergasted when that kind of change happens, which is kind of cool. All right. Any other questions? All right, cool. So if there's not any other questions, then I guess we are all set. You guys are obviously more than welcome to contact me if you want to at a different time, but that's going to be about it. And like I said, I appreciate you guys showing up, and I will talk to you guys later. Thanks.